Gentlemen, if you are over 50 and something has quietly changed during your most intimate moments, I need you to stop what you are doing right now and stay with me, because the next few minutes could be one of the most important conversations you have had about your body in years. I am a urologist who has worked with various clients and helped them reclaim their confidence, restore their vitality, and step back into their intimate lives at ages most men had already accepted as finished. And I want to talk to you today, not as a doctor talking at a patient, but as someone who has sat across from hundreds of men carrying a fear they could not even find the words to describe. You know the moment I am talking about. The pleasure is there, the sensation builds exactly the way it always has. Everything fires, and then silence. No fluid, no physical sign, just a hollow, confusing stillness where something familiar used to be. And in that stillness, one question starts screaming inside your head. What is happening to me? That question is why you are here, and I am going to answer it fully, honestly, and without a single layer of shame attached to it. Let me tell you about a man I will call George. George was 67, a retired teacher, calm, thoughtful, the kind of man who had spent his entire career helping others make sense of things they did not understand. And yet, when this happened to him, he had no framework for it, no language, no map. He came to see me 4 months after it first started. 4 months of sleeping on the far side of the bed. 4 months of making excuses. 4 months of a slow, quiet withdrawal from the woman he had been married to for 31 years. When he finally sat down in my office, he looked at the floor and said something I will never forget. I feel like I am disappearing. I leaned forward and told him, George, you are not disappearing. You are confused, and confusion has a cure. That conversation turned his life around. This one is going to do the same for you. But first, I need to give you one piece of information that changes everything, and I mean everything. Climax and ejaculation are not the same thing. Pause for a moment and let that sink in. These are two entirely separate events happening inside your body through two entirely different systems. Climax belongs to your brain and nervous system. It is a neurological experience, electrical signals, chemical responses, a wave of sensation that your nervous system orchestrates from the inside out. Your brain owns that experience completely. No gland, no duct, no valve can take it away. Ejaculation, on the other hand, is a mechanical process, a physical delivery system made up of muscles, valves, ducts, and glands that must work in precise, coordinated sequence to move fluid in the right direction at the right moment. For most of your life, these two systems fired so close together, so seamlessly, that you assumed they were one thing. They were never one thing. They just happen to run on the same track. And when one of them changes, as bodies do, especially after 50, the other does not have to go with it. Your ability to feel pleasure, to desire, to connect, that is yours. That has not gone anywhere. What has changed is one part of the delivery system. And delivery systems, gentlemen, can be fixed. Now I want you to think of your body as a highly coordinated production and delivery operation. Bear with me because this picture is going to make everything click. You have the producers, the testicles and glands doing the work of creating fluid. You have the preparation team, the seminal vesicles and prostate adding their contribution, enriching the mix. And you have the delivery route, a series of small, precise channels, and at the very end of that route, a muscular valve that acts as a gatekeeper, deciding where the fluid goes when the moment arrives. When every part of that operation runs on time, in sequence, everything moves forward and out. Clean, predictable, familiar. But when one part of that system shifts, and after 50 shifts happen, the whole delivery can be rerouted, reduced, or stopped entirely without touching the pleasure at all. So let us walk through exactly what can shift and why. Because the name of what is happening to you matters. And once you know the name, the fear begins to lose its grip. The first cause, and I see this more than any other in men over 50, is called retrograde ejaculation. I want to describe this so clearly that you will never forget it. At the neck of your bladder, there is a small but powerful muscular valve. Think of it as a traffic warden standing at a crossroads. Its entire job, the only job it has during climax, is to seal the road that leads backward into the bladder and keep all traffic moving forward through the only exit that matters. When this valve does its job perfectly, fluid moves forward, clean delivery. When this valve relaxes at the wrong moment, the fluid follows the path of least resistance, and the path of least resistance is backward, into the bladder. You feel every wave of pleasure. Your nervous system fires exactly as it always has, but the fluid went the wrong direction, and so nothing arrives. Now here is a detail I want you to file away, because men almost never connect these two things on their own. After intimacy, if your urine looks slightly cloudy or milky, that is your clue. That is the fluid that traveled backward, now sitting in your bladder and exiting the next time you go to the bathroom. It sounds alarming when described out loud, but I want you to hear me clearly. Retrograde ejaculation in itself is not dangerous. It is a mechanical rerouting, not a breakdown, not a verdict, a rerouting. What causes it? Often it is a medication you are already taking and have been taking for years. Certain blood pressure medications, certain medications for an enlarged prostate work by relaxing smooth muscle throughout the body. That tiny valve at the neck of the bladder relaxes along with everything else. The medication is doing exactly what it was prescribed to do, but nobody told you this could be one of the trade-offs. Sometimes it follows a prostate or bladder procedure. The surgery was successful, the surgeon did everything right, but the delicate nerve network controlling that valve was altered as part of the process, and nobody prepared you for what to watch for afterward. George, the man I told you about, this was his exact situation. A prostate procedure 18 months prior, a successful one, a necessary one. But 4 months of unnecessary silence and withdrawal because nobody had sat down with him and explained what the valve does and what happens when it relaxes. When I told him, he exhaled in a way that told me he had been holding that breath for a very long time. Stay with me, because the next cause is one that creeps in so slowly that most men never even notice it happening until it has already been going on for years. The second cause. The delivery pipes are blocked. Your reproductive system uses a network of small, narrow ducts to carry seminal fluid from the glands that produce it toward the exit. These are not wide channels. They are precise, delicate passages, and like any narrow pipe, they can become obstructed. Think of it this way. The factory is running perfectly. Production is normal. But somewhere in the delivery route, there is a blockage. The product cannot pass. It either arrives in dramatically reduced volume or does not arrive at all. What causes these blockages? Past infections are the most common culprit. A condition called prostatitis, which is inflammation of the prostate, can leave scar tissue in the surrounding ducts long after the infection itself has cleared. In some men, small calcifications, essentially tiny hardened deposits, form inside the ducts over time and gradually narrow the passage. Here's the particular detail I want you to pay attention to. This cause does not usually announce itself with a sudden dramatic change. It works slowly, quietly. The volume decreases a little month by month. The consistency changes subtly. Some men notice a mild, vague pressure or ache in the pelvis during or just after climax. Not sharp, not alarming, just different enough to notice and easy enough to set aside. And that is exactly what most men do. They set it aside, they call it aging, and years pass. But a blockage caught early responds well. Medication to manage inflammation can help. Minimally invasive procedures to restore the passage exist and are effective. The outcome for men who address it promptly is genuinely excellent. The outcome for men who wait and say nothing is a more complicated picture. Your body has been trying to tell you something, and that something has a solution, but only if you listen in time. Let me pause here and bring the first two causes back into focus before we go deeper. Cause 1. The valve that directs fluid forward has relaxed. The fluid went backward into the bladder. Mechanical, manageable. Cause 2. The delivery ducts are partially or fully obstructed. The fluid cannot pass through. Also mechanical, also manageable. Neither one is the end of your intimate life. Neither one has taken your pleasure. Neither one defines your strength as a man. Now the third cause, and this is the one that does not just affect ejaculation. It moves through your entire body, your energy, your mood, your drive, your sense of who you are. And it does it so gradually that most men only recognize it in hindsight. Cause 3. The fuel is running low. Testosterone. You have heard that word before. You may have had it checked once and been told your levels were within the normal range. But here is what a number on a lab report does not always capture. Testosterone is not simply a hormone that governs desire. It is the primary operating fuel of your entire male reproductive system. It signals the prostate and seminal vesicles to function. It drives the production of fluid. It regulates the intensity of sensation during climax. It maintains the responsiveness of the entire delivery system. When testosterone levels drop significantly, the whole operation begins to slow. Fluid volume decreases. Sensation becomes less sharp. The feeling of climax shifts from what you remember to something quieter, flatter, further away. And then, because testosterone does not stop at the reproductive system, the changes spread. Your energy is not what it was. Not dramatically, just enough to notice. Your motivation dips. Getting off the couch takes more convincing than it used to. Your sleep is lighter. Your patience is thinner. Your muscle tone, even with the same level of activity, feels like it is quietly softening. Your mood sits lower in the room. Most men connect none of these things to each other. They chalk each one up separately. The fatigue is work stress. The mood is age. The changes in intimacy are just what happens after 60. But they are often not separate problems at all. They are the same problem showing up in different rooms of the same house. And that problem has a clinical name: hypogonadism, which simply means the body is not producing adequate levels of testosterone to run the systems that depend on it. Here is what I need you to hear with absolute clarity. This is not inevitable. It is not untreatable. It is not something you are supposed to simply accept because you are older. A single blood test confirms it, and carefully managed, medically supervised hormone support can restore not just ejaculatory function, but energy, drive, clarity, emotional steadiness, and a quality of life that most men had quietly grieved as lost. I have watched men in their late 60s and early 70s walk back into my office 6 months after beginning a thoughtful treatment plan and tell me they feel more like themselves than they have in a decade. Not an exaggeration. Medicine working exactly the way it is supposed to work for men who were brave enough to ask the question. Now, I have to be completely honest with you, because honesty is how I respect you. In the vast majority of cases, dry ejaculation is mechanical, medication-related, or hormonal. It is manageable. It has answers. But there are situations where it can point to something that needs more urgent attention, and I would not be doing my job if I did not tell you clearly what to watch for. If dry ejaculation appeared suddenly, without warning, without an obvious cause, pay close attention to what comes with it. If there is pain, blood in the urine or in the fluid, fever, or any new loss of sensation in the genital area, do not wait. Do not schedule something for next month. Go and be seen by a urologist promptly. Certain neurological conditions, including Parkinson's disease and long-standing uncontrolled diabetes, affect the nerve signals that govern the entire ejaculatory process. In rare cases, certain neurological conditions require early diagnosis and early intervention. I am not sharing this to frighten you. I am sharing it because the men who do best are always, without exception, the men who acted early, not the men who waited and hoped the quiet would answer itself. Early evaluation is always, always in your favor. And now I want to speak to something that does not appear on any scan, something no blood test can measure, but something I encounter in my office every single week. The emotional weight of this. Men over 50 have spent most of their lives being the ones who hold things together, the provider, the steady one, the person others lean on. And so when something changes in this most private part of life, the instinct is not to reach out. The instinct is to absorb it, to carry it alone, to build a quiet wall between yourself and your partner and hope she does not notice what you are no longer offering. I have watched men dismantle 30-year marriages one silent week at a time. Not because they stopped loving their partners, but because shame told them that what they were experiencing made them less of a man, less of a partner, less. And I want to say this to you as directly and as gently as I know how. Your worth as a man, as a partner, as a person has never been measured in milliliters of fluid. Not once in your entire life. Not now, not ever. Your capacity for connection, for presence, for desire, for intimacy in its fullest sense, those things are yours. They are not stored in a gland. They cannot be blocked by a valve. They do not dissolve when testosterone drops. They live in who you are and how you show up for the people you love. The silence is not protecting you. The silence is costing you things you cannot get back. Talk to your partner. Talk to your doctor. And if you need to start smaller than that, talk to yourself first. Say the words out loud in the quiet of your own room, because the moment you do, something shifts. The problem stops owning you, and you start owning the problem. Let me bring this home with 3 clear steps you can begin today. Step 1. Investigate it. Do not ignore it. A new pattern in ejaculation, whether sudden or gradual, is a reason to see a urologist. Not next year, soon. A physical exam, a urine test, and a blood panel can give a trained physician an enormous amount of clarity in a single visit. You are not wasting anyone's time. You are doing exactly what a man who takes his health seriously does. You are showing up for yourself. Step 2. Look at the whole picture of your health. Diabetes, high blood pressure, elevated cholesterol. These are not just heart conditions. They affect the blood vessels and nerves that supply every system in your body, including this one. Men who manage these conditions well protect far more than their cardiovascular health. They protect the vascular and nerve function that the entire reproductive system depends on. What is good for your heart is good for every system downstream from it. Step 3. Break the silence. With your partner, with your doctor, with a trusted friend if that is where you need to start. Silence does not protect you, it isolates you. And isolation is where shame grows roots. The conversation you are most afraid to have is almost always the one that changes everything. I want to leave you with this. I have sat across from hundreds of men who came through my door believing that what they were experiencing was a closing. The closing of their intimate life. The closing of the man they had been. A door shutting that would never open again. And in almost every single case, it was not a closing. It was a signal. A clear, specific, readable signal from a body that was asking for attention, for understanding, and for a plan. George, the retired teacher who felt he was disappearing, came back to see me 6 weeks after we identified his condition and adjusted his care. He sat down in the same chair. He looked up this time instead of at the floor, and he said, "I introduced myself to my wife again." That is what medicine looks like when men stop waiting. You are not broken. You are not diminished. You are not behind a door that has closed. You are a man whose body is speaking to you in the only language it has, and that language is change. Learn to read it. Get the evaluation you deserve. And do not let another month pass in silence when answers, real ones, are within your reach. I am a urologist who has worked with various clients and helped them find their way back to themselves. And I am telling you today, with everything I know and everything I have seen, that your story is not over. It is simply asking you to pay attention. Stay well, stay proactive, and I will see you in the next one.